October is National Oral Hygiene Month, and today we're here at Brookhaven Dental Associates. We're going to interview Dr. Vic. He's going to show us some of his great instruments he has to help with our oral hygiene and give us some knowledge and tips on an everyday basis that we can do to improve our oral hygiene. Alright, so come on.
The greatest CEREC unit kind of makes crowns. That way, if you're in pain, we've done the root canal, we put the final crown the same day, or if your tooth is chipped, broken, we can make it in the office and get you back to work or to whatever you have to do. Basically, instead of putting a goop and all this material in your mouth, we use basically a camera. And this is the unit that takes the picture, kind of creates a tooth, and then we have the milling unit sitting over there that takes a ceramic block, cuts the block into the shape of a tooth. All we have to do is clean it up, disinfect it, and bond, or in simpler terms, glue it in your mouth. Process of making a crown here takes somewhere around 15 minutes for the machine, and of course we have to do the work inside the patient's mouth. Of course the machine doesn't do that, but literally under an hour we can give you a brand new crown, and it's quick. And Lava is a 3M company. 3M is a major brand, and they basically guarantee the product for 10 years, and hence we choose their ceramic blocks.
So how long does it take to make one of these?
A big one like that, about 13 minutes. Literally takes 2 minutes to polish it. So 15 to 16 minutes in my hands. In my assistant's hand, you can double that.
So is polishing done in your hand or in the machine?
90% of the polishing is already in the machine.
Okay.
All I have to do is put a little shine on it, and that's it. Technically, I could cut the little screw off and put it in your mouth, and you'll never know. It'll be as smooth as your natural. Perfect. There has these diamond burrs that you keep cutting, and then they get it there, and all we have to do is disinfect it.
So I'm here with Dr. Vic on FashionHealth.com, and he's already showed us a good amount of information, a good amount of his toys he has in here, which you will see later. So, Dr. Vic, thank you for taking the time out.
Thanks for having me, Jazz.
So I want to ask the most basic question first. How did you become interested in dentistry?
My journey, kind of as a teenager, I ended up needing a root canal. I was a
Wow.
bad teenager. Ended up needing a root canal. I ended up going to a doctor in Gwinnett County, and then ended up falling in love with the profession. He really took care of me. It was a great experience, took me out of pain, and I could see the value of service at the end of the appointment, because a couple hours later, when the numbing wore off, all the pain was gone, and I really idolized this dentist, and basically had the seed in my head that this is possibly what I want to do.
Possibly. You still talk to that dentist to this day?
He just retired, as a matter of fact,
okay.
So we touch base every now and then,
okay.
but he's retired and happy doing other
So I know sometimes when I personal train, one of my main goals for my clients is to get them where they want to be physically as well as mentally, because that's the most important part. So with your clients, what is your primary goal for them?
With my patients, it's optimal oral health. And also we focus on head and neck. We're not only looking for dental decay, gum disease, we're also looking for cancers in the head and neck area. Hence we make a 3D scan, and of course we don't charge extra to our patients for that. Then we take time and review the scan, and if we see anything abnormal, we refer to an oncologist or a radiologist.
So you're more than just what's happening with the tooth, you're everything.
Absolutely. We focus on head and neck. For example, if you're clenching and grinding,
right.
We inject Botox in muscles to calm that down, and also work with alternative medical providers for acupuncture, massage therapy, etc.
Speaking of acupuncture and massage therapy, what do you think has changed in dentistry throughout the years?
What we have, the change that has happened is not just from a technology standpoint, but also understanding and truly realizing that oral health is linked to the rest of your body. If you have bacteria in your mouth, it's affecting your health. It's affecting your heart. It's affecting your overall personality.
Just your mouth, and I wanted to touch on that because when I went to my dentist back home, the tooth is the gateway to the bloodstream, so it can really affect your heart. Can you explain that a little bit more?
What the relationship there is, we have good and bad bacteria in our mouth, and if we have an overgrowth of the bad bacteria, basically example would be strep mutans that cause dental decay, and P. gingivalis that causes gum disease. That bacteria is also flowing through another muscle called your heart, because it's in the blood, and an over or high quantity of that will affect your heart function. because your immune system is constantly fighting that. When you're young and healthy, it's great.
Right.
As you progress with time
Right.
and become older, it becomes harder.
Wow. So do you see a lot of clients that have that issue?
We see a lot of that. Another misconception is people think gingivitis is a term thrown around only in television by Colgate or Crest. Gingivitis, even as this morning I was looking at Colgate's website, they say it's not gum disease, it's periodontal disease. Gingivitis is a disease.
Huh.
When you have blood coming out of your gums when you brush, touch,
Right.
or when your hygienist is looking at it, that's disease. It's beginning, but between the beginning and advanced is only 2 to 3 millimeters, which, if you can realize, is not much. So we don't want to lose that, the supporting structures, which are your gums and the bone that hold the teeth in.
Right.
We don't want to lose them and then end up losing our teeth.
And so if I'm brushing my teeth one day and I see a little bit of blood, that's an indicator to go see my dentist. Is that right?
Absolutely. I would get an evaluation, I would get a cleaning, and let the hygienist, the dentist look at things.
Right.
And it's a quick appointment. It takes about 20 or 30 minutes to just do a basic cleaning.
Right.
And I feel twice a year, maybe even more, depending on what your needs are. Every
Right.
individual is different. Some people may just need it once a year. Some people a little bit more.
So what about flossing? Because flossing, can you floss too hard and cause internal bleeding as well?
Absolutely, Jazz, and that's something you pointed out. You can hurt yourself even with a string.
Right.
But your hygienist or your dentist can actually show you what we call the Bass technique. That is basically how we want to clean in between the teeth. No matter what type of fancy toothbrush do you have, no matter what mouthwash do you need.
But I have one that has a motor and everything. I need more than that?
You need more than that. You
Okay.
need the inexpensive $2 or $3 floss to go in between the teeth and clean it out. That is a necessity. It's
Okay.
not a choice, unfortunately. And it's a habit. If once we get into it, it takes me as a dentist about 20 seconds to floss my mouth. But however, as an individual, you can spend about a minute and a half to
Right.
do that. And that will really take away a lot of your dental problems. We're living till 80, 90 years old, and we want to live with teeth so we can enjoy food as we take it for granted.
Are there certain foods and drinks that are more susceptible to creating that bad bacteria?
Absolutely, Jazz. We are in a very processed food culture. Processed food is basically sugar. So a lot of times my patients tell me, well, I don't eat candy, I don't drink Coca-Cola, but they may be eating white bread 3 times a day, or eating just processed, protein bars, etc.
So it's just not sweet foods, it can be bread.
It could be just as basic as bread. We're not into a very rural, old-fashioned agricultural food product. We're in a
Right.
very processed food environment, and that really contributes to dental decay.
Wow. Any processed food, so if it comes straight from the ground, the better it is for your teeth.
Exactly.
Right.
Exactly.
So speaking of gum disease, is that more common than people really think?
Absolutely. About 70%, I can only speak for Americans,
Mhm.
we have it in the form of gingivitis or advanced gum disease.
Okay.
And there's a huge population that is not tested for it. A lot of times I have patients that come in, I said, were you checked for gum disease? They said, yes, our dentist took a look at it. I said, did they take 6 readings per tooth to measure your
Wow.
gums? And they said, no, I don't remember that. Basically, that's a true test. And as dentists, we're supposed to do it on all new patients. Unless they're just very young and extremely healthy,
Right.
and we don't have to put them through that.
Now, how would they administer the readings per tooth? Is it like electrical, or they put something in your teeth and do it?
It's an instrument. It's a very, very thin. It's called a periodontal probe,
Okay.
and it doesn't hurt or anything. Literally, the hygienist just drops it in, and within 2 minutes, we get 6 readings per tooth.
Wow, that's crazy. That's good. So it's more common than you think. So more than half Americans have gum disease or gingivitis.
Gingivitis is the beginning part of it,
Okay.
and then periodontal disease is basically where there's no turning back. You're basically married to your dentist, and you have to go in 3 or 4 times a year to keep a grip on that. It's like type 2 diabetes.
Type 2 diabetes. Wow. What is one of the biggest misconceptions of oral hygiene?
The biggest misconception is that basically I'm using a toothpaste that has fluoride in it, and I'm brushing once a day, twice a day, I'm fine.
Right.
No, you do need your dentist. You have to go in for an exam, just like you would for a physical.
Right.
You can be 30 years, be in great shape. As you're a trainer, you can appreciate that, but have high cholesterol. So
Right.
you have to get tested for that. You have to get your heartbeat checked. We see time and time again men, women in perfect health dropping dead of a heart attack. What
Yeah.
happened?
Right.
So just like that, oral health, coming in once or twice a year, getting your teeth clean,
is not hard. It's very affordable, and we all know prevention is better than cure.
I was about to say preventive. A lot of people aren't about preventing something; they're reactive, right?
Right. And reactive is always very expensive, and that's what we come across. A lot of patients are upset at the chair that they need an expensive crown or a root canal, and we all have been through it. I've been through it at age 16, so we know how it is.
Some of the criteria that I should look for when searching for a dentist.
You have to basically, word of mouth referral is the best. So if your family or friends have been to a dentist that they really like and they've had a good experience with, that's a good place to start.
Okay.
In our practice, we welcome interviews where patients are allowed to interview me either at the end of the day, and they can come and see our office, talk to me,
I wish I would have known
and see if we are a fit. And we take the time out. We can share a cup of decaf coffee or perhaps green tea at the end of the day.
This is a relationship we're building. So.
Absolutely, and hopefully it's a long-term one or a short-term one.
What is your favorite part about what you do?
The favorite part is the end result. The end result where patients refer a family member and I take them out of pain, or I do a cosmetic makeover. And some days where I'm in the grocery store down the road, someone stops me and says, "We really love your practice. Thank you for doing the root canal on me. That tooth you worked on 5 years ago is great."
Right. Wow.
So that really makes our profession just the non-monetary result that you see. It's not a job. It's basically the emotional part of it at the end of a procedure, perhaps, or a major case, or a referral when someone walks in and they tell me, "This patient has been coming to you for 5 years, referred me." It just makes our day.
Saying good things about you.
Absolutely.
Right. So, where can people find you? What is your website? And how can they get in contact with you?
We're in Brookhaven and in Johns Creek, and our website is brookhavendentalassociates.com, or you can just Google Dr. Vic Bhatia, or Dr. Vic, or Brookhaven, dentist in Brookhaven, and
he's out there pretty much, so find him. He's out there. Dr. Vic, I want to thank you so much for taking the time out. It's been a pleasure. Thank you so much for being in contact.
Absolutely, Jazz. It's a pleasure myself.
Thanks,
Thank you.